Hey, we're here with Zohaib. He's a doctor who actually graduated from medical school in China, from Pakistan, and then right now he's working in pain management. And he's unusual because he had nystagmus and amblyopia. Nystagmus is your eyes going back and forth. It's always congenital. Amblyopia means like lazy eye, not 20/20. And he is our typical result for someone with nystagmus and amblyopia. I'm the only doctor in the country dealing with these people, but we kind of want to get the word out because our patients are incredibly happy. We have over 100. We'd like to have 1,000 because we want to help these people. So I guess, so hey, you want to talk about your vision now and how it's slightly better than glasses or contacts and what reasonable expectations are?
So, what I would say, just going in surgery, I had realistic expectations. I wasn't expecting a miracle, uh, and as far as the prognosis go and what to expect in the coming months, I've been realistic about it. So far, 3 month post-op, I'm pretty happy with the results as of now. Um, so yeah, I mean, my symptoms have been better with the burning and all the other the pain. So far so good.
Yeah, I guess looking at his chart, he had a prescription of like minus 275 in the left, sorry, in the right, minus 375 in the left, two diopters of astigmatism. So, yeah,
Hmm.
categorically, he had like moderate myopia or nearsightedness, moderate astigmatism. We got rid of the myopia and the astigmatism. And pre-op, before his surgery, he was seeing 20/40 in his glasses in the
Hmm.
right eye, 20/50 in his glasses on the left eye. Just to give the context, 20/40 is legal to drive in the daytime. Sorry, 20/50 is legal to drive in daytime, 20/40 is legal to drive at night. Now, without glasses or contacts with both eyes open, he's actually seeing 20/30. So his vision is kind of slightly better than glasses or contacts, which is really amazing. So
Hmm.
you want to tell the patients how you can now drive without glasses or contacts?
Yeah, I'm actually, I haven't driven for years, but I'm excited to go back into driving. So yeah, I'm looking forward to that. Yeah. As compared to glasses, because you have to angle the glasses in a certain way, but having freedom to vision in a better, wider field. So I'm expecting better results. Yeah.
Yeah, people with nystagmus, because their eyes are going back and forth, they're not looking through the center of the lens on the glasses. So they keep looking off of the corner of the lens, and that's not optically a good part of the lens. And then even in contacts, when your eyes are moving and jiggling too much, the contact's going to move in your eye. So they get
Yeah.
like fluctuating vision. So now that we put the prescription on his cornea,
Yeah.
it's not fluctuating. That's why normally they see slightly better. This is the most interesting part for the nystagmus patients out there. I would say about 75% of the patients after the surgery say their nystagmus is better. And I guess this doctor thinks so too. So you want to talk a little bit about that?
So regarding my nystagmus, what I've noticed is, and I video recorded every month
Oh, it's pretty cool.
post
So
surgery.
he's more objective and more
Yeah.
scientific than the average person. Like about how your nystagmus is better.
Okay. So regarding nystagmus, I would say post-op, I've been recording myself every, couple of days, every week to 2 weeks. What I've noticed is an increase, improvement in my amplitude, which was what
It
bigger,
was pretty big. Yeah.
swinging back and forth, and it's better now.
It's going to be cosmetically better because
Cosmetically better,
people notice that.
yes, and so
But you figured out why. You think it's because you're seeing objects
I'm
sharper.
yes, so I'm seeing the objects sharper, and my brain is not trying to track and find the sharper,
Yeah, it's not like
object.
it's the kind of before I think with the nystagmus, he was maybe losing fixation.
Losing
Fixation
fixation.
is like
Yeah,
being on the target, and then he
yeah,
would wander back in and pick up fixation like that.
yeah,
Now that the image is sharper, it's easier for his brain just to force himself to maintain fixation.
yeah. To track the objects and fixate on the objects, so it doesn't need to move back and forth, side to side as much as it used to. So that's a major improvement I've seen.
Yeah, I've also noticed because of that, many more than half of the nystagmus patients, we've done over 100, they say they've gotten a little bit more self-confidence because, nystagmus is not common. It's like 1 in 1,000 people. So even at the checkout counter, when your eyes are going like this, sometimes the person's like, "What?" or they ask you questions. It's like a pain in the neck, okay? But they
Yeah,
said
yeah.
afterwards, when it's less, they just feel more confident. And sometimes I've actually noticed with many of the nystagmus patients, in the pre-op and immediate post-op periods, they're kind of like this because they kind of get this habit of kind of looking down so that people don't make comments or stare at them, and then
Yes.
afterwards as time goes on they kind of go more like this, and eventually they're just kind of like this. It's quite dramatic psychologically. You want to talk about that a little
Yeah,
bit?
I would say, there's a social aspect to it, and definitely just brings out more confidence that, a person is more focused on what you're trying to say
Not your eyes,
rather than
yeah.
focusing on your eyes, right?
Yeah.
So that's a major improvement, I would say. Yeah.
Yeah, I would say, look, anybody who has nystagmus or a lazy eye and was told by, I shouldn't say, and was told, you've been told by not one eye doctor, there are many eye doctors that nobody can fix this, and we're the only center in the country that's dealing with nystagmus and amblyopia. We could do the consultation remotely by video. You really just owe it to yourself. You want to just speak about that to these other people
Regarding, um,
coming in for a free consult, even though they were told no one could fix you?
oh yeah, so free consult
Like, how
is
many people told you nothing could be done in your life?
uh, a, a bunch of places.
Like
Yeah,
every
yeah.
place, yeah, every
Um,
place.
like I'm not a teenager. I've been to different doctors. I've been, I'm part of this organization, which
The
where we have,
Nystagmus
yeah,
organization.
yeah, where we have thousands of people
It'd
with
be
the
great
same
if we could get
condition.
the word out. Yeah.
Yeah, definitely. And from what I understand, they've been, opting for more aggressive options,
Like what?
surgery.
Oh wow.
Yeah, so that's not
Oh, check it
something.
out. There's some doctors who are doing muscle surgery to try to decrease the amplitude of nystagmus by tightening the muscles. If you think about it,
Yeah.
you got some, each muscle's got a certain amplitude or latitude that lets your eye move. There's unusual pediatric ophthalmologists that are tightening the muscles to try to tighten the thing. It's really aggressive. I think it's a little bit dangerous and it doesn't work very well. That's what you're talking about, right?
That's what I'm talking about, and I've seen some results were not as successful, at least in my experience. So,
One of my best friends, Kelly Hutchinson,
yeah.
is a pediatric ophthalmologist. We trained together at fellowship at Emory 30 years ago. Now she's chairman of a ophthalmology program in Westchester. She will not do that surgery because she says it's not
Mm.
proven at all and it doesn't work and it's like unsafe. Sometimes you get the thing where the muscles are just so tight that now they can't even look to the sides. They're just stuck.
Yes, and I don't know, some of them probably needed Botox, or I think that was, yeah, an option. Some people might have
Yeah,
opted for.
you can inject Botox and paralyze the muscles and
Yeah, yeah.
then see if that works. It's temporary. It's good that it's temporary because then it wears
Yeah.
off. But I don't know about that one.
So
What?
finishing the thought, having known these options, I think getting LASIK was a no-brainer for me, I would say.
Yeah,
Yeah.
you're gonna see better, and I
Yeah.
would say there's 100% chance, based on our last 100 patients,
Yeah.
there's 100% chance you see better, and there's like a 75% chance your nystagmus is better. If I had nystagmus and amblyopia,
Hmm.
and I had those odds, I would do it. There's no chance of you seeing worse.
And
Now, there's a
it's
25% chance your nystagmus is the same, but
yeah.
it's not worse, right? So think about it. Your vision's going to be better, no question about it. Your
Hmm.
nystagmus is probably going to be better. I mean, I would do it.
And it's not as invasive as the
Yeah,
other.
we're not cutting,
Yeah, yeah.
So
So.
anyway, so just look, I'm ready to retire, and no, I am. The
Mm.
only reason I'm still doing this is there's some procedure that I'm doing that nobody else in the country is doing. If I was just a LASIK dude, I would have retired 5 years ago. I don't need the
Mhm.
money. I don't need the
Mhm.
hassle. I'm not money hungry. I'd be
Yeah,
gone.
yeah,
The only reason I'm hanging in is actually for people like you.
yeah, exactly. And I'm
So
grateful for that, because I've been searching, and I've been in the city for a while, and I finally found the right surgeon for me.
well, it's
Yeah,
up to Jose, who's actually shooting the videos, so that we don't
yeah,
have to do 5 hours of Googling. So
yeah, yeah,
hopefully Jose does his job properly. You do a little
yeah,
speak at the Stagmus thing, and by the end of this year,
yeah.
I would like the waiting room just filled with this. We did a search. There's 100,000 people in the country with nystagmus. There's like 1 million people with amblyopia. So if Jose does his job right, we're just filled with these people, and I mean, we could still do the regular LASIK people, but
Yeah, yeah,
I'd rather help the
People that
people that
really
nobody
need it.
else, yeah, nobody else can help. Hey, thanks a
yeah,
lot for your, it's like a
Thank
PSA,
you.
like public
yeah,
service
yeah.
announcement. So
Yeah. Again, thanks for everything that you've done so far. And like being in the medical field, I know that there are certain kinds of doctors who really care about the patient. Um, like Dr. Chin is very, nerdy. I would say he
kind of
knows,
geeky, yeah.
yeah, geeky. Like he's interested in the patient outcomes rather than just getting done with the procedure.
There's a lot of
So
centers in New York. It's like a factory to make money, pretty much. I don't really do this for that. My family's a bunch of doctors. I'm
yeah,
third
yeah.
generation eye surgeon. My uncle's an
Oh
eye
wow,
surgeon at
oh wow,
Harvard. My
wow.
grandfather was an eye surgeon. So I didn't go into this to make money. If I
Yeah,
wanted to do that, I would have just utilized my MBA and made more money, by the
yeah,
way.
yeah,
So,
definitely.
but I'm really grateful to you for
Yeah.
helping out.
All right. Yeah, definitely.
Okay, good job. Thanks.
Yeah.